Welcome to Footprints and Impacts, the podcast where we uncover how the environment shapes our health and well-being. Whether you're curious about how chemicals in your surroundings affect you, or you're looking for practical ways to live a healthier life, you're in the right place. Brought to you by the Environmental Health Association of Canada and the Environmental Health Association of Quebec, this podcast shines a light on multiple chemical sensitivity, MCS, the importance of healthy, least toxic product choices, and what it means for those navigating this disability, where over 1 million Canadians have a diagnosis of MCS. We're here to raise awareness, offer resources for accessibility, prevention, and build a healthier, inclusive community. Let's dive in and explore how our footprints leave a lasting impact on our health and our planet. So, hi everyone, welcome to the show. Today we welcome Me Paul-Claude Bérubé, lawyer, governance specialist, and an international advocate for the rights of persons with disabilities. For over 40 years, he has campaigned for accessibility and inclusion across the world, from Canada to South Africa, from Japan to France. He is the founding president of Accessibility Standards Canada, where he contributed to the development of numerous regulations and policies, both in Canada and internationally. In July 2025, he was appointed Executive Director of COPHAN, the Confédération des organismes de personnes handicapées du Québec. His appointment marks a significant moment for the collective defense of rights, as COPHAN, the Environmental Health Association of Quebec, and the Environmental Health Association of Canada have been working hand in hand for years to present a strong and credible voice to government bodies and civil society. Maître Bérubé is recognized for his ability to bring stakeholders together, strengthen governance practices, and actively defend inclusion. At the Resilience 2025 conference, his closing speech on multiple chemical sensitivity, or MCS, issued an urgent call to transform awareness into real action. Today we explore the human rights dimensions of MCS, the shortcomings of our institutions, and the fight for justice that can no longer wait. Maître Bérubé, welcome to the show.
Thank you so much. It's a great pleasure for me to be here with you today.
Thanks. And so you've just been appointed Executive Director of COPHAN, an organization that works closely with the Environmental Health Association of Quebec and the Environmental Health Association of Canada. How do you see these strategic alliances in the fight for recognition of MCS and more broadly for the rights of people with disabilities?
Yeah, thank you for your question. I just realized that I'm in this position since almost 2 months now, and I feel to be here since 2 years, not 2 months. But your question gave me the opportunity to share my vision for COPHAN and its member. I see these alliances as both principled and highly pragmatic. About principle, our members, I mean ASEC and EAC, they honor nothing about us without us. By centering people with multiple chemical sensitivity, MCS. So I will use the word MCS for multiple chemical sensitivity for the rest of this interview. So they also consider broader environmental health in every decision, talking about being involved in a part of the decision making. Practically, they also let us move faster by aligning lived experience, policy levers, and service delivery. How it works. Basically, COPHAN is a Quebec-wide umbrella. COPHAN knows how to turn community policies into a rule that stick, also accessibility requirements, procurement criteria, and I would add to this accountability. Our two members, ASEC, who is the member for the province of Quebec, and HEHAC, who is the Canadian member specialist of MCS. They bring that knowledges on MCS. For example, what works in hospitals, schools, workplaces, and homes. So their guidance is credible and usable. It's not theoretical. And more. AHAC gives us a national lens to scale what works in Quebec and across Canada and to keep messaging consistent with federal actors and the other provinces. COPHAN has two large goals, I would say. First of all, it has to work to defend and promote the interests of persons with disabilities in Canada. But it also should serve the interests of its members. So our members are the experts on the specific issues they struggle with daily, not COPHAN. But they need our support, especially on political issues where we have expertise and skills to offer and share. So it is my vision, global vision of what COPHAN is doing to support ASEC and AHAC, but what and how ASEC and AHAC can also be an important player in the role of COPHAN. Yeah.
Thank you. And when we talk about the big picture, right, you've spent decades advocating for the rights of persons with disabilities globally. Why, in your opinion, does MCS, which affects more than 1 million Canadians, remain marginalized compared to other disabilities?
Wow. Ah, my goodness. It's an excellent question, very important. Despite affecting over 1 million Canadian, MCS remains marginalized compared to other recognized disabilities for several reasons. Quickly thinking about it, I'm gonna try to explain exactly what does it mean and what are the reasons for this. First of all, for decades, MCS was often dismissed as subjective or psychological rather than acknowledged as a legitimate disabling condition. Okay, can we say that this lack of consensus in the medical community has delayed the development of clear diagnostic criteria, but also treatments and disability policies? So the absence of medical recognition is the first reason, I think. Yeah, for sure. The second reason is about invisibility. It plays a major role. How can I say it? For example, a wheelchair or a guide dog, they are visible. MCS is not always visible. Yet it severely restricts daily life. Imagine being unable to enter workplaces, public buildings, or even use public transportation because of perfumes, cleaning agents, or construction materials. The barriers are everywhere. But because of they are environmental rather than structural, they are less obvious to others. The invisibility of the disability is, for me, the second main reason then. So I talked, the first one was the absence of medical recognition. The second one is the invisibility of MCS. And thirdly, I would say that this is the combination of these two. People living with MCS are often told that their condition is all in their head, or that they are too sensitive. This discourages individuals from seeking accommodation and reinforces system neglect. The first two reasons combined, like I said before, created the situation in which individuals were not at the forefront of the struggle to defend their rights and demand a better living condition. When I say that they were not at the forefront of the struggle to defend their rights, I don't say that they did nothing. I say that it creates some isolation. It brings them, most of them, for many years, to stay at home and not ask for any accommodation, for any accommodation. So, uh, but it changes. It changes since a few years. Uh, we also have another reason why I would say MCS is not very popular. Um, Disability rights movement have made progress on accessibility in architecture, employment, and also technology. But chemical sensitivity challenges require changes to everyday practices, like fragrance free policies, of course, ventilation standards, or safer cleaning protocols. These adjustments are relatively low cost, but demand cultural change. And that change has been slow, very slow. The fourth reason is then linked to the absence of cultural change, which is very slow and always remain a good challenge. And when I'm talking about cultural change, I mean, for example, what happened with cigarettes in Canada a few years ago, many years ago, when it was just okay to smoke everywhere, and when it becomes, after years and years and years of proof, that it becomes bad for health, and then a change of culture operate, and then it brings that today. You imagine that anyone could smoke in a restaurant, for example, in Quebec? It's impossible. So the marginalization of MCS in Canada and I would say in many other countries around the world, it's not about the legitimacy of the condition. It's more about awareness, recognition, and political will. But there are good news. Is that we now have a few models. Many universities, workplaces, and public institutions have begun adopting fragrance-free policies, safer building standards, and there is also three standards published by Accessibility Standards Canada, who includes MCS. Let me think about the name of these standards. The first one is about procurement of accessible good. The second one is procurement of accessible services. Yes. And the last one is accessible ready housing, if I recall well. I think it's exactly what it is. If we can mainstream those practices, Canada can move closer to treating MCS with the same seriousness and dignity as other disabilities. Oh, wait a minute. I can hardly believe I just said that our governance take other forms of disability seriously in Canada. Let's just say there is still a long way to go even for other form of disabilities, but the way will be longer for MCS for sure. So I just hope my answer were not too long for you. I try to answer it very clearly about the reason why we have MCS not at the same level than the other disabilities in this country, in my mind.
No, not at all. I mean, any length of answer is good for the show. It's more information. Our listeners get to hear more information, and it's always good to hear from people like yourself and give the information they give. You know, so like it's good that sometimes we try to see it. You know, was it like is it ignorance? Is it indifference? It's always hard to balance it out. You know, but. We see that the attention is growing, you know.
Yeah.
During the 2025 Resilience Conference, during your speech, you said we missed the boat. Where has Canada and other countries failed with regard to MCS? What historical turning points have we missed over the past 25 years?
Yeah. Oh my goodness. This you're talking, of course, about my speech at the Resilience Conference on May 1st and 2 of 2025. At that time, I've been asked to present this closing conference. And I recall perfectly the moment that I that I said we missed the boat in Canada 25 years ago. I wasn't referring to a specific moment in history, but rather to a series of moments. Let me explain it. Over the past 25, 30 years, science, medicine, and public policy all had opportunities to recognize MCS as a legitimate disability. And they hesitated. They even refused to do so. In the late 90s and early 2000s, there were important research emerging in Canada, but also in United States and Europe, showing that chemical exposures were linked to real measurable health impacts. That was the moment to establish a clear diagnostic criteria and invest in large scale studies. Instead of this, the debates became polarized. Was this psychological or biological? That hesitation stalled progress for decades in Canada. It was unfortunate. We did not take the good opportunity to make it to clearly engage in that way. So we knew by the early 2000s that indoor air quality, ventilation, and exposure to toxic substances in homes, schools, and workplace matter not only for people with MCS, but for the entire population. Canada did not move quickly, unfortunately, to adopt precautionary standards, fragrance-free policies, or safer alternatives in cleaning and construction. For example, Scandinavian countries were far ahead of us in creating healthier environments. We also need to consider that if MCS has been recognized at that time and much earlier as a disabling condition, workplace accommodation policies, housing standards, healthcare products or healthcare supports would have evolved to appropriately include it. Instead, millions of people have been left to navigate inaccessible, yes, and environments without legal clarity or adequate support. All of this neglect created avoidable suffering. And ironically, higher long-term social costs. We know what it is. When you have a disease, when you have a sickness, when you have a disability, and you don't treat this, when it becomes a time to treat it, it costs a lot of bucks, a lot of money, more, if we could have addressed it at the first level. But in this country, unfortunately, we are, I would say, often in reaction rather than action. So the turning point we missed was essentially a failure of recognition and leadership. Had we acted 20 or 25 years ago, Canada could today be a leader in inclusive, chemical safe environments. Instead of this, we are still debating the legitimacy of MCS, why people continue to be excluded from workplace, public spaces, and even healthcare settings. But it's not too late. It's never too late. Never too late to act and take measures, I mean. Other G7 countries and many others countries around the world treat environmental sensitivities, also known as MCS, as part of their accessibility and disability frameworks. And Canada has a chance, yes, right now, to catch up and set up as an example. So it's never too late to act. We began to do something in the last, I would say, 8, 10 years, and particularly in the last 5 years, with the engagement coming from the government of Canada and some other provincial governments, and also from the community. It's not the time to stop. We have to accelerate the work. We have to press on the button to go faster than ever. Of what it has been done about MCS since 20 or 25 years.
Yeah, I totally agree. I think we need to get in the fast lane, like you mentioned, and fundamentally, it's also a human rights framework, right? MCS. So if MCS is fundamentally a human rights issue, the right to breathe clean air, access healthcare, and work, what responsibilities do governments have under international law? Are they failing to meet those responsibilities?
Oh, yeah, my goodness. And this question about the human rights issue is a very important one. And it's probably where Canada showed the less that I would say we are not good everywhere, and sometimes it is clear that we are not good, and then you have a place here at the international level where we have been told clearly very recently that we are not good at all. So MCS is, of course, a human rights issue under the UN Convention on the Rights of Persons with Disabilities. Uh, the governments must ensure non-discrimination, reasonable accommodation, accessibility to health, work, and participation for persons with disabilities, including people with MCS. And Canada ratified the CRPD, but also the Protocol of Application. And it means that we are scrutinized by the United Nations regularly. We are analyzed by United Nations, and they bring reports to tell us where are we now. And in March 2025, the UN Committee Observations flagged discrimination and stigma against persons with MCS and called on Canada to adopt intersectional cross-sector strategies to remedy the discrimination against MCS. It's clear in their report. It's word by word what they said. So what are governments required to do by the CRPD, and are they doing it? I think it was the second part of your question. Yeah, it's pretty technical. I will try to keep it very friendly. Okay, let's go to a few articles of the CRPD to express it. I'm talking about Article 5 first. Equality, non-discrimination, and reasonable accommodation. States who adhere to the convention must prevent discrimination and provide accommodation in public services, workplaces, housing, transport, and education. In Canada, the UN Committee found persistent discrimination and specifically named MCS, urging time-bound plans to correct it. Practically, that means fragrance-free and lowest emission policies, least toxic cleaning protocols, implementing ecological strategies for our needs, and individualist adjustment in workplace and public services. Even the Canadian Human Rights Commission already treats MCS as a disability requiring accommodation. But the problem here in this country is that the implementation of any measure just hasn't been consistent. So there are also another article I'm thinking about under the CRPD is Article 9, accessibility and safe environments. Accessibility also includes indoor air quality and avoid chemical exposure. Canada has been strongly criticized by the UN Committee for the lack of measures to protect the rights of Canadians with MCS, precisely where MCS-related barriers show up daily. So it's not me who say it. It was the United Nations Committee on March 2025, not 10 years ago, but this year. Let's go over the CRPD. The Article 25 and 26, talking about health and rehabilitation. The UN Committee highlighted limited access to quality health care and called for measures to reduce wait times and tailor services, gaps that map closely onto the experience of people with MCS in this country, unfortunately, once again. So it has been said by the UN Committee. And in their report, they also talked about the Article 27 about work and employment. If I recall well, the United Nations Committee pressed Canada to strengthen employment inclusion. Governments must ensure inclusive employment and safe, accommodated workplace. For MCS, it means scent-free policies, procurement of lowest emission supplies, and ventilation cleaning standards that don't exclude workers. It is word by word into the report coming from the UN Committee. And finally, I think that they also talked about Article 31 of CRPD, addressing participation and data. Here, once again, the committee urged Canada to systematize consultation mechanism across federal, provincial, territorial lines. People with disabilities must be closely consulted in policy design. For MCS, that means structured engagement with affected communities and better prevalence impact data. You know, it is when we talk about uh, nothing about us without us, it includes the fact that we should be included into the process of decision making, and also being invited to participate to this the decision making, because we are concerned more than anyone else about this issue. So you will ask me, okay, at the international level, there we have seen this report and all the recommendation coming from the United Nations Committee, but the next question I imagine would be: Are governments failing their international obligations?
Mm, yeah.
Yeah, I do not have any other choice but to say yes about Canada. The committee's findings named discrimination against people with MCS, criticized implementation gaps in accessibility, and flag healthcare across shortfalls, not somewhere else, but in Canada, not 10 years ago, but in 2025. Here, Canada does not have a choice. Canada ratified the CRPD and is also under the protocol of application. It means that there are compliance issues that require immediate corrective actions and some more accountability from our country. Okay, so having said this, we have said, I answered to your question in saying what the CRPD was about this, and where is Canada about this. And now I would complete my answer in saying, what does it mean concretely? What would compliance look like? I will try to be very clear about this. There are a few solutions. Canada, first of all, Canada needs to adopt enforceable, monitored, and supported fragrance-free, low-emission policies across federal workplace and services. This is a minimum. This should be coupled with safer chemicals in Canada and transparent labeling of all product on our shelves. Don't depend on ventilation to reduce pollution. This is not the answer. Uh, Prevention must start at the source. It must depend on product choice. So this would be, I think, concrete, and the first measure. So I recall, adopt enforceable, monitored, and supported fragrance-free emissions policies. Uh, so the second one would be update standards and guidance to develop some chemical accessibility standards and treat this disability like any other accessibility sector. The third measure would be is about services, training clinicians and public-facing staff and services on an MCS, accommodation and clinical pathway. This include first responders, law enforcement, and even the courts. So when you need to train this person, I would say training this person will help to avoid problems in the future. It's not enough just to put in place what I call the fragrance-free, low-emission policies, but you have also to train about this, to explain what it is and what does it mean, day by day. The fourth measure would be strengthened data collection and participation, formally engaging MCS organization like ASEC and EHAC, for example, engage them in policy design and tracking outcomes across jurisdictions. Yeah, international law already obliges Canada to remove barriers and provide accommodation for MCS like any other form of disability. Like I said before, the United Nations Observations of Canada, shared in March 2025, names MCS directly. Canada must act now. They don't have any choice. They engage under the CRPD and the Protocol of Application. They don't have the choice to act or not act. They must act. And now.
Yeah, I totally agree. Thank you very much for that answer. And I know it covered a lot of the questions we were going forward, but I know you've worked on several continents from South Korea to South Africa. Are there countries that are leading the way in terms of recognition of MCS, and what lessons should Canada learn from them? In addition,
Yeah, yeah, you asked for example and lessons. Okay, wait a minute. It's very easy to me to talk about Scandinavian countries, for example, because they are always at the top of the list when we are talking about social measures. But you know what? I will use some other example than Scandinavian countries just to show you that there are measures somewhere else around the world, and not only in Europe. Then I will choose two European countries and two other countries around the world who does not include USA, for example. So showing better outcomes are possible today. With this example, I will talk about with you. It's not in theory. A few jurisdictions have taken meaningful steps on MCS or closely related chemical accessibility policies. Nothing about this is perfect, to be clear, but they offer lessons for Canada. You asked for these lessons. Here are, for example, um, Spain. I'm talking about Spain first. Spain formally recognized MCS in 2014, 11 years ago. This did not end debates in medicine, but it brought MCS into health and social protection pathways. Now, patients can be counted, coded, and considered in service design. What it was not the case before. Now they are considered and they are treated. They have access to services. Um, Let me talk about the example of Japan. They put in place a new regulation, but it's not a new regulation for them. It should be a new regulation for us. But they put in place in 2003. Yeah, in 2003, a regulation called Sick House. Um, Japan implemented national building and ventilation standards to curb indoor pollutants that trigger sensitivities and mandated mechanical ventilation. So it's in place since 22 years and it works. Uh, in Japan, all the new buildings now are built in taking care of this policy, in taking care of this regulation. Uh, the third example is at the far south of the planet, talking about Australia. In Australia, we have the Disability Discrimination Act. But under this Australia's Disability Discrimination Act, MCS has been recognized as a disability who requires accommodation. It was not the case, and I don't recall exactly since how many years it's in place, but for sure it's there. It's in their act. So the last example that I could share with you is about Germany. Germany's public agencies and clinicians have long treated MCS as an environmental medicine syndrome. National resources describe MCS and its symptom, and international reviews note formal recognition in some European jurisdictions, including Germany and Austria, for example. So Germany's public agencies now put in place resources to treat MCS. So I will take these four measures, try just to repeat the lessons that it brings for a country like us, like Canada. First of all, the lesson coming from Spain, they adopt a coding registration approach. So MCS shows up in health and disability data and planning. About Japan, the lessons coming from Japan, it is to limit emissions from construction materials and require mechanical ventilation in habitable spaces. Then they update the building code, and ventilation standards. So this is the lessons coming from Japan. The third one is about the Australia lessons. They publish national sector specific guidance for scent-free, lowest emission practices in hospitals, schools, transportation, and public service, paired with enforceable accessibility obligations. So because they put it in their act, against discrimination, it makes a real difference. This is the Australia's lesson, yeah. And the lesson coming from Germany, it is stabilize the clinical pathway. They coordinated guidance through health ministries and colleges, including screening tools and referral routes. To summarize, countries that treat chemical accessibility like any other accessibility requirement by coding it, I would say regulating air quality, guiding accommodations, and buying safer products are the ones moving fastest. So I said Spain made MCS visible in the system, Japan engineered healthier indoor air, Australia paired rights with practical guidance, and Germany stabilized the clinical pathway, like I said before. Canada? Oh, Canada could combine all four moves now and catch up. Canada could be a leader. And in all of these four countries that I gave the examples, they, like I said before, it's not perfect at all. There are so much to do in all of these countries, but they began with something. And we have good examples now in Canada coming from these countries, from USA, and also from Scandinavian countries, particularly. We, we don't have to reinvent the wheel. You know, we can take we can take the leadership in using these examples to make it better in Canada, for a person having the MCS, So it's my word about this.
And to close it up, to the person or to the people listening who feel invisible, what message would you like to give them directly?
Oh, yes, you are not alone anymore. Uh, this person has to know that the fight is engaged more than ever. We have now the ears from the governments, particularly the government of Canada, and we begin to work with all the provincial all the provincial and territorial levels. You are not in isolation anymore. We have organization at the provincial and national level who could listen to you and provide with peer counseling and provide with a good support in your research of environmental free, fragrance free place to work and to live. So I would give you a message of hope. We now have some resources that we did not have years ago. So please use it. Call the organization, a SEC or a hack. For sure, they will provide with good answers because they work very very hard to take care of this situation, and I'm very confident that this country will become a leader about this issue in the next years.
Thank you. Thank you so much, Maître Bérubé, and thank you for referencing the Environmental Health Association of Quebec and the Environmental Health Association of Canada. We are definitely there to provide resources to people with MCS. If you're listening to this podcast, you follow us. If you're new to this podcast, please follow us and see all the great resources we have for you on our websites. Maître Bérubé, thank you for your lifelong commitment to inclusion and human rights. Your words remind us that equity is not a favor, it's justice. And the time to act for MCS is not someday, it's today. So with that, I'd like to say thank you for being on the show. Any last remarks before we close it up?
It was a great pleasure to be here with you today. So let's go and continue the good work.
Thank you. Thank you. I'm looking forward to having you back on the show. Thank you. Thanks for tuning in to this episode of Footprints and Impacts. If you found value in today's conversation, be sure to subscribe, leave a comment, and share it with friends, family, and especially someone who might benefit. Don't forget to follow our upcoming episodes for more insights on sustainability, health, inclusion, and how we can all make a positive environmental impact. Until next time, stay curious, take care of yourself, and be well.
This podcast is part of the Empowering Community and Removal of Barriers project, funded in part by the Government of Canada's Social Development Partnerships Program, Disability Component.